Hi, my name is Nika Majaria and you're watching Dubai Live TV. I am at the American Hospital with Dr. Antony Brignoni, who specialises in minimally invasive laparoscopic surgery, pelvic reconstruction and gynecology. Hi, Dr. Antony.
Hi, pleasure being here.
Could you talk to me a little bit more in depth about your field?
Well, I'm a gynecologist, which is a specialty that has to do with women's health, especially referring at the reproductive organs of women. I do advanced minimally invasive laparoscopic surgery, which people know as keyhole surgery. So all the surgeries that I do could be done through tiny incisions in the abdomen. And patients could go home earlier, they recover much faster, and they could go back to work and their normal activities more faster. And I also do pelvic reconstruction surgery and urogynecology. It has to do with pelvic organ prolapse, urinary incontinence, and all that.
Could you talk to me a little bit more in depth about your field?
In my field, I see a lot of female problems. The most that I have interest in is like endometriosis. Women menstruate every month. It's called endometrial lining, and that tissue is growing outside the uterus. And it could cause pelvic pain, could cause chronic abnormal uterine bleeding. 50% of women who are infertile have endometriosis as a diagnosis, and also could cause problems with sexuality, like pain with intercourse and all that. There's an increase of ovarian cancer in patients with endometriosis. The lifelong risk of a woman without endometriosis is like 1% for ovarian cancer. With endometriosis is like 2%.
How can we test for endometriosis?
We could do transvaginal ultrasounds, pelvic ultrasounds, and to see if they have any cystic changes that are related to endometriosis. Also, MRIs could be done, but lesions that are visible on ultrasound are big. So most of these patients, you won't see anything on ultrasound or MRI.
And can individuals be affected by endometriosis at any age?
Usually it starts once you start menstruating.
Please enlighten us on the various diagnostic tools, whether invasive or non-invasive, that are available that might help to detect early stage health problems.
Like I was mentioning before, regarding endometriosis, there's ultrasounds that we could do, MRI imaging, but everything starts with a good history and a physical examination for any screening. Also other screening tools like pap smears, women should have. Now that the guidelines have changed, they should start having pap smears at age 21. Also mammography, patients should have their mammogram starting at age 40 and every year after that for screening for breast cancer. The pap smears are screening for cancer of the cervix. Pelvic pathology, another diagnostic tool which is more invasive would be a laparoscopy, a diagnostic laparoscopy with keyhole incisions.
Is there a role for robotic surgery?
I'm certified in robotics. Okay. There are some advantages and a lot of disadvantages to robotic surgery. It's in 3D. The arms of the robot, they could rotate like a normal arm. The incisions are smaller. You could put them in certain areas that are better, because with the robot there's some limitations. You're sitting on a console far away, so you need a very good team.
What are some of the big challenges that you face?
Insurance-wise, there's a lot of, it seems like a lot of insurances here don't cover prevention, like a preventive pap smear. They don't cover sexually transmitted, and cultures for sexually transmitted diseases and things like that. So that's a disadvantage, because sometimes, patients won't do a test because it's going to cost them out of pocket. So.
All right, well, thank you so much, Dr. Antony, for all your time today. It was really informative.
Thank you.